In this next chapter, we are going to discuss the anatomy and physiology of pregnancy and labor. When our babies are growing inside of us, they live inside the uterus. The uterus is also known as the womb, and there are a couple important parts of the uterus that you'll need to understand. The top of the uterus is known as the fundus. The fundus is where labor contractions stem from. Muscle fibers of the uterus contract upward as they're pulled up by the uterus, shortening and thickening the layers of muscle around the uterus. While that happens, the bottom of the uterus, the cervix, then opens up and begins to dilate. We'll talk more about the cervix in a moment. The umbilical cord acts as the tether between birthing parent and baby. Its job is to pass nutrient-rich blood from the placenta to the baby. The umbilical cord is made up of 3 distinct vessels, 2 arteries and a vein. Connected to the umbilical cord is the placenta. The placenta is an organ grown completely from scratch during your pregnancy. Genetically, it belongs to your baby, even though your body grew it. It grows to about the size of a small dinner plate and attaches to the wall of your uterus. In fact, when you have your baby, you'll give birth twice that day, once to your baby and once to the placenta. Don't worry, a placenta doesn't have any bones and is a lot easier to push out. The bladder is another pelvic organ that plays an important part in the process of labor. We'll talk more about the importance of the bladder a little later on. The vagina is the last point of exit for our babies as they enter the world. Oftentimes during pushing, we will hear birthing parents express the need to use the restroom. In actuality, it's very often baby pushing up against the rectal nerves, causing the sensation of needing to use the restroom. So if during labor you feel like you need to use the restroom, there's a good chance your baby is closer than you think. A little bit ago, we talked about the cervix being the bottom part of the uterus, the part of the uterus that is charged with dilating. But dilation is only one piece of the puzzle when it comes to labor. There are several other things that the cervix needs to do in order to go from 0 centimeters to 10 centimeters to successfully bring our babies into the world. Before a cervix can begin its journey into dilation, it has to be soft enough to do so. This softness is known as ripening. A ripe cervix suggests that the body is ready to begin dilation. Another piece of the puzzle that we need to talk about is effacement. Effacement refers to the thinning out of the cervix. In fact, by the time you push your baby out, your cervix is about as thin as a piece of paper. All of these 3 separate things, effacement, dilation, and ripeness, all impact how labor begins and how it progresses. We can tell what your cervix is doing through a use of several different tools, one of which being a cervical exam. Cervical exams are an important, but not always necessary, part of labor and birth. It is imperative that during the laboring process, and even before you get to the hospital and your clinic appointments, that your provider has your explicit consent when it comes to cervical exams. A cervical exam involves a provider putting on a sterilized glove and some form of lubricant, placing their hand inside of the vagina up to the cervix to feel for those different measurements of ripeness, effacement, and dilation. Cervical exams are subjective. Just as we all have different hand sizes, so do providers. So don't be surprised if one provider gives you a cervical exam and the results of another cervical exam are slightly different. This is based simply off of hand size and estimation. A cervical exam provides a snapshot of what your body is doing in a given moment. It does not tell us how long your labor will be, and it does not tell us how quickly baby will be in your arms. Please try your best not to get hung up on these numbers and know that the human body changes very quickly and on its own terms. While all of this is happening, your provider is also checking on your baby's station. Station refers to how high or how low your baby is in relation to the pelvis.